G'day guys, let's get stuck in with what is air pollution. The World Health Organization defines air pollution as the contamination of indoor or outdoor air by any chemical, physical, or biological agent that modifies the natural characteristics of our atmosphere. Air pollution is widely recognized as a significant and ongoing threat to public health. According to the World Health Organization, major public health concerns associated with air pollution include exposure to particulate matter, nitrogen dioxide, sulfur dioxide, and carbon monoxide. These pollutants are a result of human activities, including industrial manufacturing, fossil fuel burning, electricity generation, and increasingly environmental events such as bushfires. Particulate matter is considered one of the most significant air pollutants, especially PM2.5 and PM10. PM2.5 refers to microscopic inhalable particles less than 2.5 micrometers in diameter. Both PM10 and PM2.5 particles are small enough to enter the lungs and bloodstream. However, PM2.5 particles pose the highest risk to our health outcomes. Although air pollution is often linked to respiratory disease, increasing evidence indicates that it also has significant effects on cardiovascular health. This has become a major issue for global public health, and with the World Health Organization estimating that nearly 99% of the world's population being exposed to air pollution levels exceeding their guideline recommendations. Moving on to cardiovascular disease, also not the nicest topic, but here we are. Cardiovascular disease, commonly referred to as CVD, is a broad term that's used to describe disorders that affect the heart, blood vessels, including coronary heart disease, stroke, hypertension, heart failure, and peripheral vascular disease. Cardiovascular disease is the primary cause of morbidity and mortality worldwide, placing a considerable burden on our healthcare systems and communities. Public health strategies relating to cardiovascular disease have traditionally emphasized behavioral risk factors, which we'd all know: smoking, poor diet, physical inactivity, obesity, and excessive consumption of alcohol. However, contemporary public health research now increasingly recognizes that environmental determinants have substantially influenced cardiovascular health outcomes. Air pollution is now widely recognized as a significant risk factor for cardiovascular disease. This shift in viewpoint from a public health perspective reflects that health outcomes are determined by more than just lifestyle, not discounting them, but with environmental and social conditions contributing significantly. Public health professionals recognize that cardiovascular disease can be partly prevented through improved air quality, which can be achieved through effective urban planning, reduced emissions, and strengthened environmental policies. Linking air pollution and CVD. Our research conducted over the last 2 decades recognizes the links between cardiovascular disease and air pollution. PM2.5 particles pose a significant health risk because they're small enough to pass through the lungs and into the bloodstream. Once inside the human body, these particles contribute to systemic inflammation, oxidative stress, and damage to blood cells. As a result, this process can accelerate atherosclerosis, a cardiovascular condition characterized by the accumulation of fatty plaque in your arteries. Exposure to air pollution has also been linked to increased blood pressure, irregular heart rhythms or arrhythmias, heart attack, stroke, and heart failure. Significant negative impacts on cardiovascular health can occur from both short and long-term exposure to air pollution. For example, acute cardiovascular events may be triggered by short-term exposure to major pollution events such as bushfires or periods of heavy smog. Long-term exposure to air pollution plays a more significant role in development of chronic diseases. In statistics captured in 2019, the World Health Organization estimated that around 68% of premature deaths worldwide are linked to outdoor air pollution, resulted from ischemic heart disease and stroke. These statistics support that air pollution should not be recognized solely as an environmental issue, but also as a major contributor to cardiovascular health and public health outcomes. Let's talk about the burden of CVD next. So the burden associated with cardiovascular disease extends beyond mortality statistics and includes significant social, economic, and healthcare impacts as well. On the global scale, cardiovascular disease is a major contributor to disability, reduced quality of life, rising healthcare costs, and premature death. This burden is further increased by air pollution, which contributes to preventable cardiovascular illness and disease outcomes. So those things we can do something about. The World Health Organization reports that millions of premature deaths every year are linked with air pollution and cardiovascular disease-related deaths, representing the majority. The Australian Institute of Health and Welfare reported that in 2018, air pollution accounted for approximately 8.6% of the coronary heart disease burden and 8.3% of the stroke burden. Impacts such as these place additional healthcare pressures on our healthcare systems, and they're closely linked to increased hospital admissions, decreased workforce productivity, and persistent chronic illness. They also highlight the importance of preventative environmental interventions and strategies. As urban expansion, traffic density, climate change, and bushfire frequency continue to escalate, the cardiovascular burden relating to air pollution is likely to become a more significant public health issue in the future. Finally, we'll jump into some information about vulnerable demographics with regards to air pollution. So the impacts of air pollution on health vary across population groups and communities. Vulnerability is more apparent among certain demographics due to increased exposure, pre-existing health conditions, and social disadvantage. Aging populations are particularly vulnerable because advancing age increases the risk of developing cardiovascular complications and associated conditions. Individuals with pre-existing heart disease, hypertension, diabetes, or respiratory conditions are also at a greater risk of adverse health outcomes during periods of poor air quality. Children are considered a vulnerable population group as well because their lungs and cardiovascular systems have not yet fully developed, so they breathe more relative to their body size. Socioeconomically disadvantaged communities also often experience higher levels of air pollution exposure due to their proximity to industrial areas, major roads, or poorer quality housing. This is indicative of broader concepts relating to environmental health inequity in society. In Australia, Indigenous communities may be subjected to high levels of environmental exposure and experience reduced availability of healthcare services due to remote living conditions. Global efforts to protect and support vulnerable populations require targeted interventions that focus on the improvement of air quality standards, urban planning reforms, public health education, and climate adaptation strategies. In the long term, lowering air pollution is both an environmental concern and a matter of social justice.